Hi, my name is Kiara. In this video, I am going to be inserting an NG tube. I'm going to do an enteral feeding as well as removing a tube. So the first thing I am going to do, I am going to check my orders. Once I check my orders, gather up all my supplies, I am going to identify my patient. Ma'am, if you don't mind stating your name and date of birth. Once I saw I have the right patient and all my supplies are here, I'm going to wash my hands. I'm going to make sure my patient is in the correct position in high phallus. And then I am going to put on my gloves. Okay, once my gloves are on, I am going to start by checking for patency in my patient's nose, and that's by occluding one side and allowing them to breathe through, occluding the other side, allowing them to breathe through, noting there's no occlusion. Now I'm going to get ready to measure my NG tube and how far I need to go. So I'm going to start from the tip of the nose to the ear, and then I am going to move to their xiphoid process. In this case, it's going to be at 45. So I am going to take a piece of tape, secure that in that area. And now I'm going to take me some lubricant. I'm going to lubricate the tip really well. Once the tip has been lubricated well, I'm going to make sure I have some water here for my patient. I am going to now have my patient. I'm going to insert the tubing into the side of the nose and have my patient tip forward. If there's any type of resistance, I'm going to stop and try not to force it in there and withdraw back and then start over. And then once I see that my tube is advancing, I'm going to ask my patient to make swallows. Now, if my patient is any type of stress, then I would discontinue the procedure and try again. But in this case, I'm going to have them continue to swallow, continue to swallow. Continue to swallow. Once I have reached where my tape is, I am going to secure it to the patient's cheek. I am going to basically, well, that will be secured. I am going to check the pH of it, of the contents, make sure my pH is correct. And then once I see that my pH is correct, I am going to, I can also do an x-ray just to verify. Once I see that it is in the correct place, I'm going to take some tape and secure it more to the patient's nose. So making sure it is nice and secure. And also, once that is taped, I'm going to tape a piece to the patient's gown just to make sure it does not go anywhere. And once that is done, I am going to connect my feeding tube, or whether it be a feeding tube or a suction. Once I see that it's on based on the orders and everything is flowing correctly, I am going to discard my gloves. I am going to wash my hands, as well as document in the chart the procedure, how the patient reacted, the residual contents, placement verification, and any other type of information that is pertinent to the procedure I just performed. So after that, I will do a enteral feeding, where basically I would check my orders once again. I would identify my patient. Please state your name and date of birth. Once I identify my patient, I will make sure my patient is in the right position. I would wash my hands, put on a pair of gloves. And before I would do any type of feeding, I'm going to check to make sure, like I said, my NG tube is in the right place. I am going to once again check the pH by removing tube, aspirating, and checking that. I'm going to also check residual content. Depending on how much it is, I would either stop my feedings or I would just replace the residual contents. After that, once I saw everything is correct and in the right place, then I would take 30 mils of tap water, and I am going to flush my tubing. And after that is being flushed, I am going to, if I've had a formula, I would already have shaken it up and had that ready to go inside. Or if not, if it's depending on if it's a continuing feeding or a bolus, I would insert that, give my patient the feeding once it's connected. And after my feeding, I would make sure it's clamped. I would take another 30 mils of water and flush my tubing once again. Of course, I would have to perform any type of care. If it's in the abdomen, I would assess that, perform care there, or perform care in the nasal and oral area of my patient. I'm also going to check residual content every 4 to 6 hours, depending on my orders. And then once all of that is done, I would discard my gloves, wash my hands, and I would document in my chart what I gave the patient, how the patient reacted, intake and output, what the appearance, if it was abdomen, what it would look like, and any other type of care that I performed. And now it is time for the removal of my NG tube. Once again, checking orders, identifying my patient. Please state your name and date of birth. I will come in, making sure my patient is in the right position. I'm going to wash my hands. I'm going to put on my pair of gloves. I will make sure there is a towel draped around my patient. Also giving them some facial tissue for when I will have to remove the tube. So I am going to stop my feeding or suction, whatever it is connected to. I am going to remove all the tape that I have placed. Once all my tape is removed off, I'm going to ask my patient to hold their breath, and then I'm going to slowly remove the tubing. Okay, and once that is done, I'm going to perform nasal oral care onto my patient. I'm going to dispose of my tubing, and I'm going to discard my gloves, wash my hands, and I will document in the chart the procedure that I just performed, as well as how my patient did with it.